Hi tutors, it's Lyndall Parker-Newland here. The RACGP CCE is coming up and I just want to do a quick run through the changes of the exam and a summary of the new exam structures just to help in your teaching. A lot of this you may already know, but it may save you some time in wading through the RACGP resources. So let's get started. As you're aware, the new CCE exam is an exam of clinical competency aiming to assess clinical competency for unsupervised general practice in Australia. It attempts to replicate a consultation, allowing candidates to demonstrate their clinical skills, communication skills, and professional attributes. Now, we put this summary together recently, just 2 weeks ago, to deliver to some of the candidates in the workshop that we developed. So I thought it was worthwhile to do a quick summary for you. Now, why did they move to CCE? As you know, the exams changed a few times in the last couple of years. Prior to the pandemic, the RACGP was modernising the exam, so moving it from the OSCE, which was based on disciplines, through to the assessment of competency in the CCE. However, the pandemic got in the way. So RCE became the transition exam. It was kind of the middleman as they started to assess competency, but it wasn't never designed to be the final product. So CCE is what they were always planning before the pandemic got in the way. It is slightly more flexible and it can move between face-to-face and remote as needed. The sitting that's coming up in November will all be remote, obviously, because of the pandemic. But in the future, some components can be remote, some components can be face-to-face as needed. So the exam dates for 2021.2 are Saturday the 6th and Sunday the 7th and the 13th and 14th. So our students will have one day on the first weekend and one day on the second weekend, with results coming out in December. If you're watching this in 2022, obviously the dates will be different and they're available on the RACGP website. So what's different? Well, basically, if we look at the original OSCE and then move through to looking at the CCE, knowing that the RCE straddled somewhere in the middle, obviously it's gone from large groups in person to individual and flexible delivery, which for this sitting will be fully online. The OSCE was delivered in one single session. The RCE has been developed in 2 or 3 sessions over time, and this is now finalised to 2 shorter sessions. There were 3 minutes reading time in the OSCE. They went to 5 for the RCE and are staying at 5 for CCE. That's a really good thing, particularly for a lot of our students where English isn't their first language. It gives them more time to think, read and process the information. Those short stations that were 8 minutes and 19 minutes in the OSCE and then 10 minutes in the RCE have been expanded to a full 15-minute case. Again, I think that's of benefit for our students. While they can ask a lot more questions in a lot more depth, again, it gives people more time to think, process, and really explain and show their knowledge. Now, they've moved from 2 examiners to 1 examiner per station, but there are some simulated consultations with actors. The OSCE was mainly simulated consultations. It really was kind of a whole lot of role play and drama performance. That's now paired right back to less focus on that and a lot more focus on the thinking and demonstration of clinical reasoning. Now, previously, the OSCE was about disciplines and was mapped to core skills, but the CCE has moved into clinical competencies to guide assessment. And this actually matches modern assessment theory and practice worldwide. So this is just bringing the exam back up to speed to what we've been doing at a university level for some time. So when we talk about those clinical competencies, this is what the actual clinical competencies are. And so these 10 competencies are where you're going to find most of the content for the exam. Now, most of these are no surprise: communication skills, clinical information gathering, making a diagnosis. But it's easy to forget things like professionalism, practice systems and regulatory requirements, managing uncertainty, and knowing that these can still exist in the exam. So being comfortable with these, I think, are quite important. When it comes to timing, as we said, there are 9 cases of equal length and they are 15 minutes each. Now, they're delivered in 2 sessions, so 2 sessions of 2.5 hours. Okay, so one session will be all face-to-face clinical encounters, and the other session will be all case discussions. I think that's actually a really good thing. In the previous OSCE and in the RCE, it was a little unpredictable and you'd bounce between the two, which is quite a mind shift and also quite a language shift, moving from speaking to a patient to speaking to a colleague. Having one day of one kind of question, I think is going to be better and better able to manage. There's 5 minutes reading time, and at the end of each paper, case, there's 4 minutes of marking time. Now, the types of cases, there are two kinds of cases. The candidate and examiner interacting, these are the case-based discussions, or the candidate and the actor interacting, which are the clinical encounters. Okay. In the first kind, there is just the two people online. In the second kind, where it's a clinical consultation, the examiner will be simply observing the interaction. Oh, I should go back and just one more point. There are 4 case-based discussions and there are 5 clinical encounters. So we know exactly what kind of cases there'll be. One thing that you will note is there is no critical analysis paper anymore. Now, that doesn't mean that critical analysis may not come up. It could come up in any of the case-based discussions. It could even come up in a candidate and actor interaction in a clinical encounter if a patient read something in the newspaper or asked you a question about a test. All of those things are possible, but the sending the papers out, analysing them, bringing them back, that process that they trialled for RCE seems to be gone. So when it comes to these two types of questions, two types of stations, there's a couple of things to think about. So the case-based discussion, candidates are giving case details. They're told the patient summary, the background history, the results photos, that kind of thing. Now, the candidates will be given the number of questions and the approximate timing of each. It's included in the case details. Now, they won't know what the questions are, but they'll have an idea that there's 5 questions they need to tackle, or there's 2 questions, or there's 10 questions. Examiners will have strict timing of those questions. And so they will know that question 1 is worth 5 minutes or whatever, and be able to manage that time. Okay, so that's probably a more explicit move that we've seen before.